Hello, everyone. My name is Michael Mazzefi. I'm an anesthesiologist and an intensive care physician. It's a pleasure to be here with you today. And I'm also here with Dr. Boban, who will introduce herself.
Hello, everybody. My name is Ana Boban. I'm working in a hemophilia center in Zagreb, Croatia.
We're going to be speaking with you today about von Willebrand disease, and specifically, we're going to talk about surgical patients with von Willebrand disease. So we're going to talk about two cases, and we hope these will illustrate some important principles of management, patient management. The first case I'm going to describe, and then I'll maybe ask Dr. Boban some questions. We have a 42-year-old man who presents for spine surgery, lumbar spine surgery. Interestingly, or of note, this patient has a history of von Willebrand disease, type 2A, and he has a history of some excessive bleeding with a prior dental procedure. You see the patient's laboratory values here, and importantly, we have the patient's von Willebrand factor antigen level and the von Willebrand factor ristocetin cofactor activity. Now, I want to ask Dr. Boban, let's say this patient comes to see you before their surgery, so about a week ahead of time, so we have some time for planning. What laboratory tests would you send for the patient or would be important to consider? And how do you think we should treat this patient during the time or around the time of surgery?
This patient obviously has increased risk of bleeding during the surgery, and this is obviously high-risk surgery. So therefore, we want to make sure that hemostasis at that time is perfect for this patient. So we have a couple of options of treating patients with von Willebrand disease. That's the DDAVP and the von Willebrand factor concentrate. And regarding the low levels of von Willebrand factor in this patient and the high-risk surgery, I would go with the von Willebrand factor concentrate to treat him. So to know how to measure or how to dose the treatment, I would have to do another new findings of von Willebrand factor activity and factor VIII. And if it's possible to have the data, how he responds to this treatment, to the treatment of von Willebrand factor concentrates, what's the half-life, so I can tailor the treatment because we want to make sure that the von Willebrand factor activity is around more than 50%, but on the other hand, not to have too high activities of factor VIII, not to have risk, not to increase the risk of thrombosis during the surgery.
Well, thank you for that answer. That's very helpful. And I can say as an anesthesiologist, it would be great if the hematologist that I were working with gave me some recommendations like that, a dose of von Willebrand factor concentrate, and then also how to monitor for the efficacy of that treatment. Let me also ask you, if I may, would you use or recommend some other treatments, for example, the use of antifibrinolytic drugs around the time of surgery? Is that something that might be helpful?
Yeah, antifibrolytics are very helpful in patients with Willebrand disease, and actually they have really low risk of side effects. So yeah, definitely I would include. But also I would definitely try to talk to the neurosurgeon to understand what kind of surgery is going to perform, what kind of operation, and what is the risk of bleeding. So I think the multidisciplinary approach here and close collaboration between anesthesiologist and neurosurgeon and also hematologist is crucial. Also, I would like to point out that good communication with the coagulation laboratory is crucial because sometimes you will need to have findings of von Willebrand factor levels and the factor VIII levels within 1 hour or 2 hours. Sometimes this has to be talked in advance, so the coagulation laboratory is expecting these samples to come to the laboratory and to be done quickly. Yeah, I just wanted to ask you, what is the view of anesthesiologists, and do you think it's good to have a good collaboration with hematologists during the operation, or do you think that it can all be settled in advance?
Yeah, this is a very good question. Ideally, I think you have a good working relationship with the hematologist, and if you need to, of course, we have a plan ahead of time, and we can execute that plan. But there always are unexpected events, so it's nice to be able to contact your colleague, the hematologist, in case there's a little more bleeding than anticipated. Perhaps we need a second dose of von Willebrand factor concentrate. Maybe a lower second dose, but I think that would be the best kind of situation.
Yeah, thank you. I agree with you completely. So on the other hand, we have another patient. She's a 22 years old lady that is pregnant. She's now in the 32 week of the pregnancy. And she has Willebrand disease that was diagnosed when she was a child because she has positive family history. Actually, during her lifetime, she didn't have so many bleeding episodes. She has uh, extended bleeding during related to her menstrual bleeding and a couple of epistaxis, but no other spontaneous bleedings. And now she is coming to the clinic and asking about the type of delivery and type of anesthesia. What would you recommend to her, Dr. Mazefi?
My main points would be that with appropriate planning, it is possible to safely have an epidural placed for labor analgesia, or a spinal if needed for cesarean section. But appropriate planning is needed. And if appropriate planning is in place, there's probably minimal increased risks. So I think it is possible, but it will require measurement of von Willebrand factor levels, perhaps treatment, but can be done safely, and that's great for women who want to have some pain relief during their delivery.
Yeah, thank you. That's a very good answer, and actually very positive for our patients with von Willebrand disease, because we can tell them that delivery is actually something that is safe, and they, if managed properly, there is no increased risk of excessive bleeding. So just to point out for the patients with von Willebrand disease that the activity of Willebrand factor is rising throughout the pregnancy. So for some patients, it's sufficient to have a level that is enough for epidural anesthesia, but for some patients, it's not enough. So we have to know exactly what the level of Willebrand factor is at the time of the delivery to know to add some hemostatic treatment if needed. So what do you think about patients after the delivery? Do they have increased risk of bleeding at that period?
Yeah, this is a good question. I think that's sort of the period where we really have to be careful, right? Because we know at the time of the delivery, everyone is very vigilant, paying close attention, but there is bleeding risk in the days following, as you know. So I think we have to continue to carefully monitor the patient for at least a week or so after the surgery, to make sure we don't miss sort of a low level and we have excessive bleeding.
So we had a lot of patients that actually done fine throughout delivery, and then afterwards have the significant decrease in Willebrand factor activity, and then needed treatment a couple of days after the delivery. So thank you, Dr. Mazefi, for this very nice overview of our patients. Can you please just sum up in one sentence what is the most important issues regarding the patients with the von Willebrand disease and spinal operation?
Yeah, thanks, Dr. Boban. It's been nice talking about these cases with you. I think my main takeaway points are planning is very important in advance, collaborative approach with good communication in case we have some excessive bleeding that we didn't anticipate, but with good planning, appropriate treatment, we should be able to mitigate the risk and not have excessive bleeding in these kinds of cases.
Yes, thank you. And I feel the same for the pregnant patients with Willebrand disease. I think the most important is to plan ahead, to have multidisciplinary approach, and to have these procedures in the facility that has good hemostasis department, good coagulation laboratory, and also specialist of gynecology and surgery. So thank you, Dr. Mazefi, for this very nice interview with you. I enjoyed it.
Same. I enjoyed it very much. Thank you.